I'm glad to welcome everyone to our first council conversation of the year on nutrition, kidney health, and student success. So I am Gina Maffei, the Administrative Director for the Northwest Kidney Council. And today's discussion was sparked by something that we noticed during this year's legislative sessions, that both Oregon and Washington introduced legislation this year aimed at providing free breakfast and lunch to all K-12 students. You know, when we talk about chronic kidney disease, which impacts approximately 1 in 7 adults nationwide, we know that prevention is possible, but that it needs to start early. Representative, I'm going to start the first question with you, and that was really what motivated you to sponsor and support this legislation, and why is sort of school meal access a priority for you or your district?
I mean, you guys know better than I do. You can't really treat your way out of a bad diet. So long term, I think that as we start to see the impact of kids having regular access to food, I think it obviously will improve school performance is the hope. Developing good eating habits, avoiding obesity, some of the chronic conditions that come later in life. And I think, really long term, keeping people out of dialysis treatment facilities and the burden that costs, not only them physically, emotionally, and financially, but also the state as well.
Food insecurity is a big issue, and it's getting even bigger. A lot of patients who use food banks, a lot of the choices that are there are not kidney friendly.
Can you talk to us a little bit more about what makes a kidney friendly diet?
Yeah, so if you want to be kind to your kidneys, the first and foremost thing to look at is low salt. In this day and age, Americans have at least 2 to 3 times the amount of salt that they need. One thing that a lot of kidney patients do, if you're chronic kidney disease, not on dialysis, you are really supposed to limit your protein intake in a lot of cases. Watching your protein amount is going to be, something that comes as a shock to a lot of kidney patients. Those are basically the two. And then, of course, if you have diabetes, managing your diabetes.
Representative Javadi, what role do we play in helping to support this legislation at the level, or how can we work with your office or your colleagues' offices better to help make sure kidney patients' voices are being heard?
Most importantly is that most of the policymakers, legislators are not from the healthcare space. Most of them have no idea what diabetes is. They wouldn't be able to pick a picture of a kidney out if you showed them 4 options. So I think education is super important, and that's where professionals like yourselves make a huge difference. I think second, building those relationships now to talk to a legislator on a variety of things. Information is gold, and so are those relationships.
What is one thing that you wish more people understood about the connection between nutrition and kidney health?
I think I wish that people knew that it makes such a difference. Nutrition makes such a difference, and you can see it pretty instantly. What you eat matters. What you take in matters. Eventually, it catches up with you.